Hi, I'm Tom Bagwell, and welcome to Hello Health, a partnership with WGNO, the Ochsner Health System, and Humana to bring Ochsner's Hello Health weekly education and information series to you. Today's topic, joint replacement of the hand and wrist. Our guest is Surgeon Jay French. First, some background. Dr. French received his medical degree from the Tulane University School of Medicine. He also did his internship and orthopedic residency there. His advanced training includes a hand surgery externship at the Florida Orthopedic Institute and a fellowship in hand and shoulder surgery at the Baylor College of Medicine in Houston. Dr. French joined the Ochsner Health System in 2013, and it is our pleasure to welcome to Hello Health, Dr. Jay French. Good to have you with us.
Thank you, Tom. Thanks for having me.
Yeah, so you were an athlete in your earlier days of some sort, right?
Nothing too exciting, but I did the usual football and soccer.
Okay, and those are things that occasionally you get injured with, and is that in some ways what led you to a career in medicine?
You know, I think it really was. I had a number of orthopedic injuries when I was younger. Sort of got to meet some of the orthopedic surgeons in town, and probably led me down that path a little bit.
And this is even more specialized than that. You're not doing knees and backs and working with shoulders some, I guess, but really
Yes.
Specialization, right, of the hand and wrist.
Right. Well, orthopedics has gotten so big that everyone now has subspecialized into different parts of the body, you know, the knees and the hips and shoulders. And as hand surgeons, we do cover the whole upper extremity. So really the shoulder, elbow, and the hand are sort of included as one group.
Well, for the people who don't play football and soccer and don't have issues related to those, hand arthritis is still a problem for most people, whether you were on the field or not. How big a problem is it, and how many people will develop some form of hand arthritis?
Right. Well, arthritis of the hand is very common. We see it probably in about half of the population over 65. Now, some of those people will eventually need some treatment, some won't. But we do see the typical features of arthritis. We have people have pain, stiffness, swelling of the joints, and in the hand that's a problem because it often leads to loss of function, loss of motion, and of course pain.
We're using our hands all the time and for everything. Now, arthritis itself, we talk about hand arthritis, but that can come in many forms. Let's break those down if we can.
It can, and there are different types of arthritis. Probably the most common type is osteoarthritis, and that is what we think of as sort of the aging process, the wearing down of the joint process. Very common in the hips and knees, but also in the hand, and that's what we see the most of.
And the other kinds?
We also have inflammatory arthritis. This is more of what we call an autoimmune type problem. It's not really a wearing down, it's more of an inflammatory process. And this includes the rheumatoid arthritis, lupus as a type of arthritis, and also psoriatic arthritis. And these tend to be much more disabling. They usually have an earlier onset for the patient, many times in the 20s or 30s. And as I said before, they're autoimmune mediated.
Okay, so how are we treating hand arthritis?
There are different ways to treat arthritis, but we typically start with the conservative approach. We start off with the oral anti-inflammatory medications. These are the ibuprofens, the aspirins, Advil, those type of medications. And that's something we can start over the counter. But we do have prescription versions, and we'll move on to those when needed. And from there, we also have different types of therapy. We have physical therapy, which in the hand, we often use occupational therapy. That's sort of a subspecialty of physical therapy that deals with the hand and upper extremity.
And what's happening there? Are we building muscles or reconditioning muscles? What's happening in that area?
With therapy, a lot of times it's just the movement. We want to improve the movement of the joints. They can also address things like swelling and strength and these types of issues. And we also have splints. Oftentimes the therapist will create a splint or a brace for the patient, maybe something that covers the finger or the thumb. You know, your typical wrist braces you can buy at Walgreens, but we also have the custom-made splints that can be made.
We've tried those. Maybe they've worked for a while, maybe they haven't worked at all. So what's our next step?
We also have injections, and these are the corticosteroid injections. Often we give those in the knees for athletes, but we can also give them in the hands. And we use the smaller joints, and this can be very helpful in reducing inflammation.
Now, what's happening in there? What are you injecting, and how does it work?
Well, cortisone is a type of anti-inflammatory. It is sort of the best anti-inflammatory we have. Now, we do use it sparingly because it can have some side effects. But what we're trying to do basically is reduce the inflammation in the joint. And this can work for any type of arthritis, especially as we talked before about the inflammatory arthritis conditions respond very well to injections.
Are there people who will just continue to get the injections for the rest of their life and won't have to proceed to the next level?
Yeah, that can certainly be an option as long as you don't do too many injections. An occasional injection once or twice a year can be many times all that a person needs.
All right, let's move to surgery. What are our options there?
Surgery is sort of broken down into 3 different categories. We initially might consider what we call a synovectomy. This is basically where we remove some of the inflammatory tissue of the joint. And this might be done for those types of arthritis conditions that we mentioned earlier, like rheumatoid arthritis. We're going in and just taking out some of the inflammatory tissue. It doesn't really work well for the osteoarthritis conditions, which are more of a wearing out process. For those types of arthritic conditions, we'll typically look at either a fusion or an arthroplasty. A fusion would be when you would fuse the joint together, basically eliminate the joint, and an arthroplasty where you're replacing a joint.
Okay. Typically, how long would these surgeries last? What's the recovery period?
Well, the good thing about hand surgery, most things can be done in an outpatient setting, meaning the patient will come in for a one-day surgery and then go home after the surgery. Typically may take an hour or 2 for most procedures. And then following that, they would follow up with the surgeon in a week or so. And
recovery time, so if I'm a writer and I'm right-handed and it's the right hand, am I out of business for a while? How does that work?
It depends a little bit on which joint we're talking about, but I would say for most joints in the hand, you would have to restrict your activities for a week or 2. But usually after a couple of weeks, you could probably get back to most things.
Okay. And if it's not normal wear and tear, so it's one hand to the other, I injured my hand bowling or playing football or tennis, I understand that. But when it is normal wear and tear, do you usually find it in both hands with patients?
As you mentioned earlier, the dominant hand is usually affected the most. So if a person is right hand dominant, we'll typically see more symptoms in that hand. But people are symmetric, so many times I'll have a patient that may have come in for surgery on one hand and then later on come back for the same surgery on the other hand. So we do see that as well.
Our guest this week is hand surgery specialist Jay French. Today we're talking about hand arthritis, and now we're going to talk about some of the materials used in surgery. So walk us through that if you would.
Well, as we mentioned before, arthroplasty is basically replacing a ruined or destroyed joint with some type of artificial material. Now, people are familiar with the hip and knee replacements. Well, these are just variations on that we do in the hand. And for many years, we've used silicone implants, which are sort of the plastic, you might think of as a molded plastic implant. And those have been around since the 70s, and they have a long track record. They may not be as strong as some of the other newer materials, but silicone has done very well for many, many years.
Before we get to this next picture, we want to warn our viewers, if you're a little on the squeamish side, we'd ask you to probably consider closing your eyes for just a minute or so. We'll let you know when it's okay to look. But this is a hand actually opened up and you're putting it in, right?
Right.
So let's take a look.
Right. This is a surgical picture from an actual operation. And what we're doing here is we're putting in the silicone implant. It's a one-piece hinged joint, and it has a stem on each side, which actually goes inside the bones being hollow. And this is the way we put the joint in, and it then becomes a new hinge joint for that joint in the hand.
Okay. You mentioned pyrocarbon titanium implants. So how has technology changed, and how has that been helpful to you as a surgeon?
The silicone implants, after a number of years, will tend to break. So we've been looking for better implants, better materials to use, and titanium and pyrocarbon have been used in the last few years for joint implants in the hand. They hold up very well. They're not without their problems, though, and so we have to be cognizant of that. But these are what you might think of as smaller versions of a knee implant, where you might have a plastic and metal combination or a ceramic combination.
Are these meant to last forever?
The material itself is for much longer than the silicone.
Okay. And what about tissue implants?
Tissue implants have been used traditionally for the thumb joint, or what we call the base of the thumb joint. And when we talk about local tissue implants, we're talking about using the patient's own tissue. And this can be in the form of a tendon or a capsule or some other type of local tissue that's harvested from the same hand.
Okay. We're going to talk about the thumb in more specifics in just a moment, but I want to ask you, with the way things, I don't know if you're a Westworld fan or not on HBO, but I am, when they're building bodies from complete bodies and robots that look like human beings. Do you think that day's coming? That not that we're going to build robots,
right,
but that you could replace anything in the hand at all, or replace the entire hand one day?
Well, one thing I think that's coming along probably in the next 10 years or so is going to be these new type of stem cell tissues that are grown in the lab and then used for implants. And the advantage there is that it could be actually harvested from the same patient and then put back into that patient, sort of growing their own tissue in the lab. I think that's going to be coming along soon.
Okay. And not that you're an occupational therapist, but I'm sure you work with them and know them. So like I'll wake up in the morning and I'll have a small little issue here or there, and I'm doing these sorts of exercises. Is there anything you can recommend to people as far as moving, keeping things moving?
Well, moving is very important, especially for the hand and fingers. We probably see, or at least the biggest problem that I deal with is stiffness in the hand. So getting patients to move their fingers and having the therapist teach the patient how to move their fingers and keep them moving is very important. And that can be after an injury or even after surgery, because a lot of times after surgery the body's natural tendency is to not want to move. And we have to sort of overcome that a little bit.
Okay. I know we're not talking this morning about carpal tunnel in great detail, but I would like to talk about it because it's something a lot of people hear about and more people are getting treated for.
Right.
Do we just now know what it is, and that's why we're hearing more about it and people are getting treated for it? Are we doing things differently? Obviously working at computers, right. But let's talk about that.
Yeah, I think it's probably a little bit of both. And as a hand surgeon, I see a lot of that. Carpal tunnel basically is sort of an overuse situation that affects the nerve that goes to the fingers. I think we're on the computers more, as you mentioned. A lot of hand usage type of activities, and of course people are living longer, and it is something that increases with age. So that's probably part of it as well.
Again, I'm guessing you're not an ergonomics specialist, but can you talk to us about where that keyboard is and how important that is, that it needs to be lower than the hands, and exactly what's happening in carpal tunnel and how are you fixing it?
Yeah, carpal tunnel basically is where there's too much pressure in the wrist joint or in the carpal tunnel itself, and that affects the nerve that goes to the fingers. And that's why a lot of people will have numbness in their fingers. That's what we see a lot, numbness in the fingers with carpal tunnel. There are different ways to avoid that. We have splints that we can give people to hold the wrist in a correct position. You want to avoid a flexed posture. It's very common at night. We see this, patients wake up in the middle of the night with numb fingers, and that's almost always carpal tunnel. We think it's from sleeping with the wrist bent down or flexed down. And we prescribe splints to prevent that. All
right. Move back to our presentation and talking about the thumb and some of the problems that can develop there.
So the CMC joint, we call it the CMC joint of the thumb, is basically where the thumb attaches to the wrist.
Here, show me.
On my hand, it's right here.
Okay.
And it's typically at the base of the thumb, right where the wrist would connect.
Okay.
And this, for various reasons, is a very common site of arthritis. in the hand, probably related to the use of the thumb in gripping and power grip and strength activities. But as a result of that, arthritis will affect that joint, and then it causes the usual problems that we mentioned: stiffness, pain, and eventually a loss of function.
Okay. Now, I know I talked about people on computers, but we're also on cell phones a lot more than we used to be, or ever. Weren't around. And most of us, I know in my case, I'm using my thumbs more than ever. That could also be a contributing
It certainly could.
factor?
It certainly could. It's still probably early on to be seeing any changes, epidemiologically, but we may see that down the line.
All right. We're going to talk about the wrist in just a moment, but first the doctor's brought along a patient testimonial. This is one of your thumb patients, is that right?
Right. This is a patient who had the problem with the CMC joint of the thumb, and we did a interposition arthroplasty with local tissue.
Let's see how it worked out.
I came in to see Dr. French. My hand was bothering me, and he said it was arthritis. It was actually on my thumb, and he checked it all out and everything. It had been bothering for a while, so I just decided to go ahead and schedule the surgery to have it taken care of. It's a same-day surgery. This is my scar from the surgery in August, where he went in, he cut, and then a little scar where he went in, I believe he did like a little stitch in there where he has to do the nerves and stuff to reroute them. Okay, this is the surgery that I had November approximately 2 years ago, which I can now do anything I need. There's the little one up on top again. And I can do anything I need to lift with this hand that I need to. This was probably easier than having my appendix or something out, really. I'm feeling good about it. I'm in my therapy, doing my exercises and everything that I'm supposed to be doing. I would recommend having it checked out by your doctor, and Dr. French is wonderful. I highly recommend him. And do it, get it over with, and your life will be totally different.
And we thank her for sharing her story with us. She's doing fine now?
Yeah, she's a really great patient. She's doing well.
Talk to us about before we get to the wrist, about some of the complications that can come with surgery or any of these other treatment options.
But as with any surgery, we worry about infection and wound healing problems. But we are lucky in the hand because the hand has such good blood flow and vascular anastomoses that we really see very little infection. Probably the biggest problem we have is stiffness. Fingers will stiffen up after surgery, the wrist will stiffen up. And we really try to prevent that with early therapy, exercises, and really getting the patients out of a cast or a splint. The technique I use now a day, I should go back and say that when I started 20 years ago, we pretty much put everybody in a cast after this surgery, after this thumb surgery. And now we've sort of learned, if we can avoid the cast, the patients do better.
Get it moving earlier?
So that's exactly what we do. After about a week, we get the patient moving and avoid anything like that.
When someone cracks their knuckles, are they really cracking their knuckles and really what's happening? And there are people who swear that it's good for you and others who say that's probably not a good idea. I'm asking the expert here.
So when people do that, it's actually a release of air pressure in the joint. And that little pop is the air pressure releasing. We don't really think it causes any harm to the joint. I think everyday life probably affects the joint more than that. But if people have some relief from it, I think there's nothing wrong with it.
All right. Do you crack your knuckles?
No.
No, okay. And neither do I. It drives me crazy. All right, now let's talk about the wrist and some problems that can develop in the wrist and treatment options.
So the wrist is just a larger joint. Earlier we've been talking about the smaller joints of the hand as you move closer to the fingertips. But as you move up to the wrist, you're talking about a larger joint. For that reason, we do tend to use the standard metal and plastic components. And again, very similar to what we use in the hip and the knee, we're trying to provide a good stable joint that will last over time. One of the problems we've had in the wrist is that it's a joint that does have a tendency to dislocate. It's doesn't have a lot of strong support to the wrist joint. So some of the newer designs have been designed to prevent any dislocation problems.
And what were you doing 20 years ago versus what you're doing today?
I think just better designs in the last few years. 20 years ago, it was not a great operation, not very successful. But I think the implants that we have today are much better.
Yeah, talk to me about the materials. We do have some time. The materials you're using in wrist surgery.
For the wrist, we typically will use a titanium implant, and that is something that's a certain type of metal that will hold up well over time, and it will articulate with a plastic component. The plastic usually being made out of polyethylene, and it gives a nice smooth articulation with the plastic and the metal together.
Okay. And in orthopedic, kind of returning back to where we started, you ended up in orthopedics and then the specialization that we're seeing now, as you pointed out. How did you end up in specializing in the hand?
Well, when you go through orthopedics, you do a little bit of everything. You do the hand surgery, the shoulder, the hip and the knee, everything. And you sort of get a feel for what you like the best and you know, what you're good at. And that applies to everything, sports medicine and foot surgery and the like. I always liked hand surgery because the patients, you know, they came in with a real problem. You know, they couldn't use their hand or their wrist or arm, and it seems like you were able to really help them out a lot in terms of their function. Even with just a carpal tunnel surgery, that can improve really people's lives a lot just by helping them sleep better sometimes.
Absolutely. And as we wrap up, you talked about what you were doing 20 years ago. What will you be doing 20 years from now, or those who follow you? What will they be doing 20 years from now?
If I'm still in practice, which hopefully I will be, we will probably be doing different things that haven't come along yet. Just in hand surgery alone, from when I started, you know, things have changed drastically, but for the good, for the better. And I'm sure in another 20 years we'll have biologic implants, maybe things grown in the lab that we can re-implant and that might hold up better than the metal that we use currently.
And we heard from one of your patients, but finally, as we wrap up this morning, what advice would you have for someone who is struggling with pain, but you know, don't go to the doctor? I can get through this.
Right.
It'll get better. What advice would you have for people?
Well, you know, it's interesting. I see a lot of patients that come in with these joint problems in the hands, and when I talk about, you know, therapy or splinting or even surgery, they very common response is, well, I didn't know that you had all that. I didn't know you could do all that. So I think my advice would be to just come in and talk to your doctor, see what he can recommend for you, because there's so many things that maybe you hadn't thought of or a patient hadn't thought of that we can do to help.
Good. Hopefully we've helped with that this morning. Thank you so much, Doctor.
Thank you for having me.
Dr. Jay French. I want to thank the doctor for the education and information he has provided this morning and for his work in the Ochsner Health System. To make an appointment with any of Ochsner's physicians, including this week's guest, or to register for any of Ochsner's Hello Health seminars, you know, they take place almost every week across the greater New Orleans area, you can call Ochsner at this special number, the number you see right there on your screen, or send us an email. There's the address, hellohealth@ochsner.org. As a reminder, you can re-watch this presentation or most of our Hello Health programs on Ochsner's website at ochsner.org. It's that simple. Just type Hello Health in the search area. Our thanks again to this week's guests. Thanks to Humana and Ochsner for making this program possible. And our final thanks, as always, is to you for your support of this program. Hello Health. We'll see you next time.